Welcome to This Explainer. Today, we're going to map out the ultimate central highway of your body, the mediastinum. It's the most bustling, high-traffic compartment inside your chest, and it works completely nonstop, every single second of your life, just to keep you alive. Let's dive right in.
Take a deep breath for a second. Feel your lungs expanding? Now, I want you to visualize the exact space sandwiched right there in the very center of your chest cavity, securely positioned between those two inflating lungs. What exactly lies in that busy, vital space? I mean, it's definitely not just empty room. It's a packed, incredibly dynamic environment that holds the core engines of your cardiovascular and respiratory systems.
So let's quickly define our terms. Fundamentally, the mediastinum is a septum. It's a dividing wall made up of a mass of tissues and organs that completely separates your right and left pleural, or lung, cavities. But the absolute key word here is mobile. It's the middle compartment of your chest, and it is anything but static. To really grasp this, we kind of have to contrast the classic textbook view with reality. If you were an anatomy student looking at a cadaver, you might think of the mediastinum as a rigid, stiff, unyielding structure. But in a living, breathing person, it is a highly mobile, squishy, and shifting space. It is packed with hollow viscera. These are organs that are constantly expanding and contracting. They're bound together by loose connective tissue and cushioned by fat. It literally has to be flexible so it can accommodate the constant beating of your heart and the swallowing of your food. The blueprint. Let's map out the boundaries of this space. Think of your thorax like a three-dimensional apartment building. At the front, your protective front door is your sternum. You can literally tap on it right now. The sturdy back wall is your spine, specifically the thoracic vertebrae. Your roof is the superior thoracic aperture, which is that opening right at the base of your neck. And the floor, that's your thoracal-abdominal diaphragm, constantly powering your breathing. Finally, the sidewalls are formed by the mediastinal pleura, which are the membranes wrapping the inner aspects of your lungs. The grand divide, splitting the real estate. Because the central apartment building is so packed from top to bottom, anatomists draw a line to create an upper and lower floor. If you find the horizontal ridge on your upper chest bone, that's your sternal angle, and draw an imaginary line straight back to your spine, hitting the disc between your fourth and fifth thoracic vertebrae, you create what's called the transverse thoracic plane. Everything above that line is the superior mediastinum, and everything below it, down to the diaphragm, is the inferior mediastinum. The lower quarters. 3 specific rooms. Looking at a lateral chest x-ray like this one, you can actually see these invisible borders mapped out on a real human. Notice that massive, bright white shadow right in the lower middle? Yep, that's the heart. Because it's so incredibly dominant, it acts as the primary anchor. It occupies the middle room and naturally creates entirely distinct spaces right in front of it and right behind it. Let's detail the tenets of these 3 inferior rooms. The middle mediastinum is basically the VIP penthouse. It's the pericardial sac and the massive organ it protects, the heart, along with the roots of its great vessels. The anterior room, right behind the sternum, is a very narrow front porch, mostly holding loose tissue. And finally, the posterior room sits behind the heart. It acts as the major service elevator for tubes like your descending aorta and esophagus as they pass down into the abdomen. The superior mediastinum, the upper floor. This upper floor features a brilliant, deliberate organization split purely by function. The right side is completely dominated by large expanding veins, specifically the superior vena cava and the brachiocephalic veins, which return deoxygenated blood to the heart. On the flip side, the left is the exclusive domain of large, powerful arteries. It proudly features the mighty arch of the aorta and its branches, pumping oxygen-rich blood out to the body. So veins on the right, arteries on the left. It's an amazing setup. The clinical reality, why this geography actually matters. Here is where the architecture becomes a literal matter of life and death. Those thin-walled veins on the right side, they need a lot of room to swell and expand enormously when your blood flow increases. So the body naturally provides a dead space for them. But nature's design has a bit of a fatal flaw here. This necessary dead space acts as a silent, accommodating pocket. It unfortunately allows mediastinal tumors to grow completely undetected for a long time, without immediately compressing any vital structures or causing obvious symptoms. And that beautifully or terrifyingly illustrates another dangerous clinical reality. Remember that very narrow anterior mediastinum right behind your breastbone? Well, it doesn't have a hard roof sealing it off. It is physically continuous with the pretracheal space up in your neck. What does that mean for you? It means a severe infection that starts high up in your neck or jaw can act like it has an all-access elevator pass. It can travel straight down the loose tissue planes directly into your central chest cavity, causing a highly life-threatening condition called mediastinitis. As we wrap up this explainer, I want you to reflect on just how incredible this anatomical space truly is. Every single bite of food you swallow, every breath you take, and literally every drop of blood in your body passes right through this one dynamic space. Considering all of its vital cargo, how incredible is it that our breath, blood, and food are all so deeply unified by this single central highway? Thank you so much for joining me today.